in understanding costs of healthcare, one is able to do a number of things better. And also, from my point of view, there is a very significant ethical consideration here, which is that it is very important for us not to waste a dollar in public healthcare. So any way in which we can understand cost better and therefore identify ways in which we may not be using our funds effectively is a way in which we can potentially save money in order to treat a further patient.
Activity-based management is absolutely fundamental to the New South Wales Health Strategic Plan. One of our priorities is better value care. And better value care requires an understanding of the quality of outcomes and the price at which that is delivered.
The ABM portal, the Activity-Based Management Portal, has been a key tool that has spun off from our adoption of activity-based funding as the key basis of our performance and funding framework for our local health districts. It's a rich information source which, through the portal, is very easy to use, and it links our financial data from our financial systems to our clinical data from our patient systems, so that we're able to see exactly where dollars go and how the way we distribute our resources results in clinical care, and it also gives us important information about how we can improve our clinical care and how to support that with how we resource the system.
The ABM portal impacts patient outcomes by helping us to refine our understanding of what's adding clinical value to the care experience, both in the acute stage and the rehabilitation stage, and on an ongoing basis for those people who require ongoing care.
This is a game changer. This is part of a suite of processes we have placed in New South Wales to do as much as we can to get the best healthcare for everyone.
ABF and the ABM portal has been the most significant improvement that New South Wales Health has made in recent history to understanding the costs of public health care in New South Wales.
MRIs and X-ray on board.
It's given us a single source of truth, which cut down the time significantly and improved collaboration across the system.
I'm blown away by the massive information, the number of individual patient episodes that are included in this. I can drill down and look at variation in length of stay, in costs. And what we're doing is providing this information for managers, bureaucrats, clinicians to use the one set of data across the whole system. No one's arguing any longer that that's not my information. So that's the big difference with this compared to previous data systems.
We actually changed from what happened in the past with limited evidence to why it's happening right now with lots of evidence, and also taking to what's happening next. The priority for us is always treat patients and provide the best account for the patients. And the way we join the data and the way the Qlik application has provided this information back to the clinicians and to the users enables them to zero in to the lowest level where you can identify a patient and the journey throughout the year in the last 3 years. And how many encounters, how many visits, what type of visits, how long they spend in hospital, how much they cost, and why they were in hospital.
Qlik has been tremendously popular in my environment because it's easy to use. During a conversation, if somebody has found something or they wish to investigate something, others can quickly pick up on that idea and go to the source.
You can't manage what you don't measure. If I was a hospital manager, I'd be very keen to know from my department managers why length of stay is such and such, why their theatre costs are 3 times the cost of another comparable institution doing the same caseload. In one area health service, we found a difference of $1,000 for a hip prosthesis between 2 hospitals 20 kilometres apart.
We've been able to see a recognised bending of the cost curve over the years of implementation of activity-based management, where our average cost of delivery has decreased whilst not compromising quality outcomes at all. And in fact, you could argue that quality has improved over that period.
Our system is very, very transparent, right down to the level of an individual clinician treating an individual patient. And it allows very informed decision-making about how we organise and fund our services across New South Wales Health.
The transparency around how we allocate budgets has been a tremendous insight for many health services across the state. The efficiency and application and understanding of that has driven us to improve our service delivery and inherently understand the costs of those service delivery options. But I think the third and most important thing is the benefit to patients with the quality of outcomes. When we see variation that is unwarranted or unnecessary, activity-based management enables us to deep dive, understand that, and improve the models of care, hence better patient outcomes.
The last 5 years have been 5 years of extraordinary growth in very close daily collaboration with my clinical teams in the way in which we jointly run the business, the way in which we jointly talk about and care about the experience of patients, and the way in which we are imagining the future.